Dr. Atul Gawande helped transform the conversation about aging in his book, Being Mortal, Medicine and What Matters in the End. His book was on the New York Times bestseller list for 85 weeks. It spent 8 weeks at #1 and is now available in paperback. Dr. Gawande is a professor at Harvard Medical School. He is also a surgeon at Brigham and Women's Hospital in Boston. Dr. Gawande, so good to see you.
Glad to be here.
We were discussing this before the show. With everything else that's happening, no matter when this subject comes up, it always prompts a big discussion. How do you think the conversation about end of life has changed since this book came out?
I think the big thing that's changed is that people are getting the idea that this isn't about death panels. This isn't about, are you going to give up? This is about, what are you fighting for? People turn out to have priorities in their life besides just living longer. We need to ask people what their priorities are, especially when they have a serious illness or frailty. If we don't ask, our care and what we do to people isn't aligned with what matters most to them, and then you get suffering. But when you do ask, it's extraordinary, and people are just now, they're starting to ask.
Words matter like what? I mean, it really got me thinking about how I want to die, when I want to die, even though I have no say over it. You know, it made me think, what is the best way to end your life? And it's not, what is the best way for life to end, rather? And you said it's not about the quality, it is more about the quality, not the quantity of the life.
Yeah, here's the important thing. This book, it seems like it'd be really scary, right?
Yeah.
How do you have a good death? That is not the goal. The goal is not a good death. The goal is a good life all the way to the very end.
So what should we be asking?
Yeah. So what you have to ask are things like, what's your understanding of where you are with your health? What are you willing to go through, and what are you not willing to go through for the sake of more time? What's the minimum quality of life you'd find acceptable? What are your fears about what's ahead with your health? And people then say, I read about a man who said, his answer was, well, if I can watch football on television and eat chocolate ice cream, that'll be good enough for me, keep me going.
And I'll go through anything to do that.
I'll go through anything to do that.
Yeah.
If I can't, let me go. It's the best living will ever. And then you start asking, well, would that be good enough for you, Gayle? Would that be good enough for you, Jeff or Norah? And the conversation starts.
I like how you've reframed this debate and about how in medical school, the whole thing is about how to save lives, but we don't talk about the demise of life. How important is that, not only from a financial perspective in terms of Medicare, but from a moral perspective?
Yeah, I mean, I think what definitely starts the conversation sometimes on a public stage is we spend a quarter of all Medicare dollars on the last year of life, most of it in the last couple of months, and it's often, the evidence is it's often increasing suffering rather than improving life. But the real moral question is getting to that focus on, how do you want to live? What really matters to you? And we don't ask that question. I tell the story of a medical director in a nursing home who fought a battle to allow people to have pets in the nursing home. Yeah. There was a fight with the staff, there was a fight with the director, there's the fight with the regulators, because they all say, well, it's not safe. But life is bigger than safety and survival. Do I have love in my life, which the pets brought? Do I have responsibility? Do I have something to care for? And so the people actually had lower drug use, and they lived longer.
Well, you say most people want to fight till the bitter end, until they're told that, where the doctors say there's nothing more we can do, which is really not a good way to look at it. That's how I've looked at it. Not a good way to look at it, because there's always something doctors can do,
but at what cost?
But at what cost?
Yeah, and the real question is not, do you fight or do you want to give up? What are you fighting for? My father, I tell this story, a surgeon had a brain tumor, and then when we asked, what are you really fighting for? For him, it wasn't chocolate ice cream and football on television. It was to be at the family dinner table with family and friends and be able to enjoy that experience at least some of the time. And so then we could guide around the fact that if he lost that, that's when, just make sure he's not in pain.
Here's a little nugget for you to have
Gawande.
children. Chances of avoiding a nursing home directly related to the number of children you have, especially if you have daughters.
Yeah. Thank you, Dr. Gawande.
Daughters take care.
Thank you.
Thank you.